Morning. My name is Harrison Pierce. I'm the Chairman of Health and Human Services Commission. Thank you all for zooming in. We're speaking of the Irish, and I'm here at the University of Notre Dame, and with a reunion. I won't tell you which one. It was put off for a couple of years because you all can do the math, and you get, the older you get, a little more sensitive to the topic, but whatever. My fantasy this morning was to have this, instead of in the room where I am now, out in front of the library, because it has an enormous mural which depicts, and the composition comes from a zillion different countries. It depicts Christ and the apostles and the saints and the scholars. And Jesus has his arms outstretched like this. And, Notre Dame is known for sports and especially football. And so he got the nickname Touchdown Jesus. And if you look, right, there's a reflecting pool where I was going to sit right in front of the library, and then across the way is the football stadium. So I was going to give you views of both, but I wasn't sure of the reception, number one. And secondly, the rain was in the forecast this morning, so that made the decision easier. And just one little thing, outside the library, there's a sculpture of Moses with the 10 Commandments, and he has his hand and his finger up in the air like this. So we always felt that, even Moses wanted Notre Dame to be number one. So anyway, all right, we'll move on to the agenda.
Okay.
Thank you for appearing. Let's see. First item is the approval of the May 5th minutes. Any corrections? May I have a motion to approve, please?
I'll make a motion.
Second. Okay. All in favor?
Aye.
Thank you so much, Alyssa, for doing that again. The next item, reports, Health Department, Jen.
Okay, so I sent you all my written report. So we'll just gloss over the numbers at the top. Not much has changed with first doses and second doses. Percent of total population fully vaccinated, we're at 89.41%. Percent of total population with a booster, meaning 3 doses, 55.53%. The state still hasn't broken it down with the 4th booster of the 50 and over. The total number of doses administered by the health department to date is 24,267. We're still doing mobile clinics at Waveney, Silver Hill. We're still doing homebound. We did 29 homebound in May. The vaccination updates for the pediatric is 6 months to 6 years old for Moderna, and the 6 months to 5 for Pfizer. They're meeting this month in the next couple of weeks, the AICP, FDA, and in CDC. So they're expecting the last week of June to have whatever approvals from whichever maker. And then state DPH has already sent out pre-order forms for us. So we did I did send back the pre-order. So in case one of them is approved, we will have some on hand. I only ordered 100 because I don't think the demand will be huge. A lot of people probably just go to their pediatrician, but we will have it available just in case. The cases in May, obviously, if you look at any of the charts, were very high. Luckily now we're on the downturn that we're back in June, which is historically the last 2 Junes. It's really sad that now I can say that we're on our 3rd June, but the cases are generally low in June. So right now this week, I have 34 cases. That doesn't include today. Waiting for the schools. The updated numbers will be out tonight. State DPH numbers, there's a total of 224,442 cases among fully vaccinated, which accounts for 8.24% of the 2.7 million vaccinated. Now, as a disclaimer, obviously that doesn't include the home tests. So there could potentially be a lot more fully vaccinated people who were tested positive, but tested positive at home. So the state doesn't have their numbers. Our numbers include, and the school's numbers include, home positives and confirmed positives, just for transparency's sake of those who reported it. Testing, A total of 129 rapid tests in May with 35 positive for 27.13% positivity rate. In comparison, in April, we only had 8 out of 90 positive for an 8.89% positivity rate. So you see from April to May how much things changed. PCR, kind of the same lines, total of 323 PCR tests in May with 72 positive for a positivity rate 22.29%. We're still piloting the new Casetivity test reporting database. We've had a couple meetings with them already and some changes, and they're tweaking it based on what we're saying. So that's going well with DPH. I also sent, because of Russ had asked in the April email about school cases. So I did provide the chart of school year last year to this year's school year. And as you see, there's a very dramatic difference between last year and this year. So hopefully June will be nice and quiet, but you know, you just never know. Environmental health updates. Chris did all the pools in May, except one. The only one that's not done is Horizons at the country school, because they're never ready till the third week of June because of their camp. So they'll contact us when ready, but all have paid. For salon relicensing, that was sent out. Chris will be inspecting all of them prior to June 30th. We've gotten 6 applications so far out of 40 salons. So we'll see how that one goes. The septic and garbage truck relicensing was sent out in May. June 15th and the 22nd, I'll be at the transfer station with Donnie doing those inspections. And then it just breaks down 31 septic inspections in May, 15 soil testing, 15 septic plans, 12 new septic permits, 5 new wells, 11 new restaurants, 20 temporary food permits, 7 housing, 41 building permits. The EBLL letters, those are people that's children's level was above 5, but under 10 that need to have to be retested. So I sent out those letters. The ticks, only 1 out of 9 came back for the bacteria that's positive for Lyme. So that's good news. This week has already been pretty busy with the ticks. So I think June's numbers will be a lot higher. For just public health emergency preparedness, everything's on schedule. Region 1's planning on hosting a FEMA ICS 100 and a 200 level training for new staff for June. And it's part of one of our deliverables for the CDC and the FEP grant. My grant renews on July 1, same, it's 11,708. We did training for radiation for first responders and local health on May 19th. Again, another one of our deliverables. So everything's on schedule with that. Other general updates, I had to do a 5-day FDA course. For my food inspector contact hours, they're not extending our certification period. So even though training wasn't really offered for 2 years, we are now having to play catch up and get all our hours in before December. So I took the 5 days last week and, you know, got it done that way. It was pretty painful. Chris will be doing something similar in the coming weeks. The Community Health Improvement Plan, the next meeting with Norwalk Hospital is June 10th, New Vance, sorry. I did attach it for you guys to see what the letter that was sent out with via the libraries listserv, the YMCA, Aggie put it in the Lapham newsletter, and I sent it out via my email list. And Rita Bettino from Town Council is going to help me post it on one of her social media groups. May 10th, I had to attend a training entitled Connecting the Dots Using Shared Risk and Protective Factors to Address Sexual Violence. The state DPH provided a grant to this Connecticut Alliance to End Sexual Violence. And there are 9 sexual assault centers in Connecticut, Rowan Center being one of them. Part of the grant, their grant, is they have to build relationships with local health departments. So we had the first training in May. I'll be meeting with the program director, Sarah, in the coming weeks when my schedule allows me the time to do so. One of the big things that came out of legislative session is this new public act where local health has to provide QPR training. So I have to attend the training of the trainer training. I've already attended the 1.5 hour QPR training. So, and that's on question, persuade, and refer training for suicide prevention. I'll be doing that up in Plainville. And how many trainings we're expected to give. It's an unfunded mandate. They didn't provide any money for any of this. And it's kind of another thing being added to local health. We also have a meeting with the commissioner on June 23rd. And this is one of the topics brought up, that these things are snuck into legislative bills, and yet the funding's not attached for us to do this work. The legislative session also did not expand the per capita funding to towns less than 50,000 as was proposed. So the governor did not approve that. The legislation did not approve that. So towns under 50,000 or have less than 3 towns, meaning New Canaan, Wilton, Darien, Ridgefield, Trumbull, Monroe, basically half of Fairfield County, does not receive a single dollar from the state per capita, where all the other towns that 50,000 or more, or 3 towns or more, get per capita, but based on population. So, and that's another issue with the public health emergency preparedness grant. They base it off population, but we all have the exact same deliverables. I have to do the exact same work that Bridgeport and Stanford have to do, yet they get 10 times the amount of money to do the work. So these are issues that we're bringing up to the commissioner that need to be addressed about, equal funding here, or funding in general. And I added another chart about the epi surveillance. One of my 7 surveillance systems I'm in now has for suicide that's linked to urgent care in ED departments. So I pulled up the last 90 days and you can see how it's broken out by age of who's been in. And I found it interesting to see the 25 to 34 age group as the highest age group. But we'll see. And I'll let you know in July what comes out of the QPR training. And that's it.
Jen, Russ Barksdale, great job with the report. I just had a couple questions. The grant for your nurse is that coming up, or did I miss that?
That's still, it's every health department, it's still pending with the Attorney General. It was supposed to have been granted March 1st. Now they're hoping for July 1st. We don't really know. So, but the Attorney General had to change all the language because they removed contact tracing from it and added other things to it. So
if the grant isn't awarded,
we're getting the grant. We just don't know when.
Oh, gotcha. I gotcha. The second is that, the minutes reflected that CHIP, the Community Health Improvement Plan, is mandated for local health. Is Nuvance's survey that we're using for New Canaan, does that meet the criteria for the state mandate?
Yeah, Nuvance gets the money and they partner with local health to do the actual work. It's how that works.
Can I just ask a question about that? Because I'm new to the commission. How often is that survey done? I mean, I took it. I thought it was great.
Usually it's every 3 years.
And then it's just, they decide how to act on it.
Well, and it helps drive the funding.
Okay.
So if the community, like obviously what New Canaan is gonna have is totally different than Norwalk generally.
Mhm.
And Peter's on my group at Nuvance too. And so like in Norwalk, they tend to say, food insecurity and housing are their 2 biggest issues. Where in New Canaan, it usually tends to be mental health or other things that are not tied so much to, money per se.
Okay.
Which is why each town has to do their own, because it is going to be totally different from what we need and what Norwalk needs.
Right. No, thanks.
And, it takes the guesswork out of what people want. you can guess all you want and assume things. I had this conversation with the Y the other day, because they're in their program planning, and I'm working with them on their strategic plan. And, you know, this data will help them too in program development and what people are looking for.
No, it seemed good. I just was curious how you could, you know, act.
I have a question, Jen.
Yes, Jim.
Jim Lusher, Commissioner. I know a number of people at all ages that are saying, oh, I don't need a booster. I don't even need the first booster, let alone the second booster. Is there anything we can do or anybody is doing around the state to try to get these people that are rational, educated people that understand? And the reason they don't want to do it is because they know that it'll have a reaction for a day, maybe 2 days. So somebody had an advertising campaign. You can have 1 or 2 days of feeling off, or you can die or feel really terrible. Is there anything that anybody's using as a campaign to get up to 90 or 90 plus on all those demographic cohorts?
The state is still doing their, you know, TV and social media push, but, you know, surprisingly, like New Canaan, not surprisingly, but New Canaan's on actually the higher of the scale.
Yes.
In comparison to the rest of the state. I think a lot of that has to do with we're still actually holding the clinics routinely. A lot of towns have, you know, gotten away from it. Pharmacies have gotten away from it. And a lot of people are holding out for the fall, you know, and seeing if there's going to be a different Omicron booster, you know, specific booster, because they don't want to get it in say May and then be told in October they can't get another. So that's another issue.
But
Like the children to age 5 to 11, we just started that last week of boosters of that age group, and very, very minimal came out for that.
yeah, it's
I mean, we're still getting 100 people at a clinic, so it's not like we're getting 5 people, but it's not the numbers we had. No, and we're not into 80%, 70%.
well,
So,
basically it's my understanding that the basic shots last, if you've got a double shot base, it lasts 6 months, and then you get another 6 months out of the first booster. And
well,
then,
I think, you know, everyone's different. It depends. You know, I had horrible reactions to the first 2. The third dose, I had no reaction, and I've never gotten COVID. And so, and I swab positive people every day. So there's kind of no rhyme or reason to sometimes of, you know, why things happen.
It's the shield, Jen.
all right.
Smart Alec.
All right, thank you.
Commissioner Alyssa McKenzie, I have a question. Jen, when you speak to the commissioner about the unfunded mandates, is there anything that we can do to support you, like a letter or anything that would be helpful, just to reiterate what you have already been telling them?
Well, no, I got Tom O'Day and with Senator Haskell and Lucy Dathan to all, you know, weigh in on it. Unfortunately, you know, it's one of those things. I don't know if it's because we're Fairfield County or what's predominantly who's affected. The state really likes to push districts for whatever reason, you know, especially with the workforce shortage. You know, there are several towns coming up in the next 2 months that if they don't find someone with an MPH and an RS, because we've become unicorns, they're going to be forced to join districts because they don't have the proper statutory, you know, stuff. So even though if you look at the data, the towns that were single municipalities actually offered more services than the districts. Because if you have 15 towns or 5 towns, you're not going to be able to, you know, provide the care that we can give to our residents one-on-one. You know, years ago, the state tried to push this with New Canaan and Norwalk, and that didn't get very far. And this grant, until I got it removed from Norwalk 2 years ago, was tied to Norwalk. They got all our money to do everything. And luckily I got all that changed right before the pandemic hit, because then all our mass dispensing would have been in Norwalk. So there was a lot that goes into all this.
So you're doing your job too well.
We're keeping our fiefdom, don't worry.
Thank you, Jen. Any other questions? No, move on next.
Yeah. Harrison, Tom Ferguson, Commissioner. How's the situation with the hospitals with respect to COVID? And then secondly, I read that in the Boston area, the hospitals are getting inundated with emergency care and ambulance visits and just overload of patients needing urgent care. And it's not COVID, it's everything else. And
Correct.
and I'm wondering, are we seeing the same thing in our region? I would think we're not much different from there. It's not a COVID thing, it's the everything else that is really taxing the health system, particularly bad because we are short of professionals to work in hospitals now. So can you comment on what you're seeing?
Yeah, well, the Norwalk Hospital, as of about 10 days, 2 weeks ago, were 5 inpatient COVID patients with that absolute diagnosis, as opposed to being concomitant with something else. And there were 2 in the ICU. Stanford's been roughly the same, maybe a little bit more in terms of inpatient COVID patients. Summertime is another time of the summer viruses, and they can cause issues. And, whenever we've all learned when with the flu being dropped and respiratory syncytial virus, et cetera, and the drop in that over the last couple of years being related to masking, distancing, sensitivity, et cetera. Some of these things have come to the fore now. And even as we were talking about the kids and not being interested, a lot of children have had those that had the 2 primary vaccines, and then they've gotten sick afterwards with a minor variant or mild variant of Omicron, and the family sees that and they say, well, it's had COVID, why we really don't have to go for this booster, and that's at play also. I don't know that Boston, what's going on in there. Sometimes things are very regional with outbreaks, and what specifically is causing the issue, or there are multiple situations.
Thank you.
Sure. Bethany, next, Human Services Department.
Hi, Bethany Zorro, Director of Human Services. The usual programs for food pantry, blood pressure clinics, OSHA, bloodborne pathogen training, and the Get About all are functioning as usual. The Get About is seeing an increase in rides as more and more people become confident in getting out there with COVID. So that's good. Lapham Center, their engagement in the programs is doing much better as well. Mental health first aid training held a course last week, an 8-hour training. Jen, I don't know if this might work in terms of a deliverable, but let me know.
No, it specifically says local health. So that's the problem.
Yeah, okay. So we had 10 organizations, EMS, CERT, the Y, Waveney Care, Horizons, Staying Put, Get About, the New Canaan Public School System, churches, people at Town Hall. They all participated in this 8-hour mental health first aid training. And it was very well received. And even though it was 8 hours long, it didn't seem like it. And there were CEU credits for this. The other thing is continued meetings I have done throughout the month with the New Canaan behavioral health aspect for the town, and the New Canaan Community Foundation, Silver Hill, and the town are focusing on providers and professionals, networking and supporting the partnership between Silver Hill and the town with the ARPA funds for behavioral health assessing. And everything is on track with that. The goal is for a gentle, soft passover down through the system. Once Silver Hill does an assessment, there's got to be a navigational path, and we want that to be as strong as the assessment itself. So this Behavioral Health Alliance, which we're working with Silver Hill and the foundation on, hopefully that'll be one more aspect of engaging in mental health strengths for the area. We're working with the Y in terms of their strategic planning too, and the focus for they're reaching out to the human services is the behavioral health and the senior programming. So those are the two areas they're looking at. Looking at a nationwide program. It's called Active Minds, and it's an initiative to bring their peer-to-peer, student-to-student program to the high school. Right now, Active Minds has 13 schools in Connecticut, 10 are colleges, 3 are high schools. We're meeting next week with New Canaan Cares and the public school system and the town to discuss the possibility of opening a chapter at New Canaan High School. What happens is it's a registered student organization, and I think it's been around since 2003. You can look up, it's activeminds.org, based out of Washington. And there's over 600 campuses that they have chapters at now. It's a student-to-student model addressing the fact that 67% of young adults are more likely to seek help from a friend than anyone else for behavioral health. And, so training students to students, and it will be run. This is why New Canaan Cares is a possibility. There needs to be an adult supervisor. They have unbelievable speakers. This could also be a benefit for the New Canaan Cares and choosing the right speakers and the right public service agenda for the town. And what else? Just a lot of meetings, and wanted to say that one of the town council members reached out to me and really wanted to come in and learn about the human services aspect to the town. And we had a nice, like an hour. She came in, saw what was going on. I urge anybody, if they're interested, for the one-on-one at Human Services, you get a much better idea of the individual base contact that we're doing, and just discussing things, answering questions. So wanted to let everybody know it really worked out well, and we're open for any type of learning more about human services and how we run. That's it. Any questions?
Yeah, Bethany, Russ Barksdale, Commissioner again. Thank you for coordinating that 8-hour program, and
Thank you for coming. Absolutely. No,
it was a great event, and thoroughly appreciated. So thank you for that. Do we have any stats at all on Get About? Because we've been talking to Get About, as you know, about transportation needs of the seniors in the community, and we have 4 vehicles that are being underutilized. So do you have any stats at all on Get About of how many rides that are
I do. I can send that. I can send their monthly, it should be coming out actually pretty soon, in terms of their most updated, their spreadsheets. I can get that to you, Russ.
Okay.
And everybody else.
And when we looked, as we're talking about different issues, I was really shocked at Jen's, some of the data and stats in her report, like the 90-day suicidal ideation. If you annualize that, you're over 100 in New Canaan residents. Does that seem high to you? Or does that seem like what a reasonable number would be if you extrapolated all of Connecticut's numbers?
Right. Does it seem high to me? It's so difficult to be able to verify the numbers, because I think it might even be higher. Who knows? People are just not coming out because of the stigma. I think there's a lot of silent pain going on. So number wise, I don't know, but definitely the public health issue of having resources and making it a more approachable topic. I think it could be even more.
Well, that's my point. If again, depending upon the source of this information, people not coming forward, what would we expect? For a town of 20,000 people, what would we expect that number to be roughly? Do we have any idea? What that rate is?
For New Canaan, no, I do not have those numbers, or whatever the numbers are, I imagine.
Yeah, I just, again, looking at these numbers by themselves, it seems, very alarming, and you're probably right. It is a higher number. I just didn't know for a town our size, if that is considered a small number, or, if it's something that really requires a lot more attention from us.
Well, just so we're clear, these are confirmed from hospital records. So
Right.
these are directly linked. So these aren't just, going to your normal doctor. These are directly linked to hospital EDs. So the numbers are going to be absolutely higher because these are only associated with EDs. So yes, it is very alarming. And, and I think it's more than just a stigma issue. It's also, a cost issue,
Insurance, absolutely.
Insurance doesn't cover. I mean, I'm going through it right now. I mean, they don't cover it. They want a credit card. So that's, how it works.
No, I mean, that's the importance of the Silver Hill ARPA to fill in that gap for sure. I'm just looking at, when we're talking about, CHIP and the assessment and the local health, that may give us one picture, but actually having the actual data and stats on some of these illnesses and issues with the community, I think is critically important for us to go after additional grants and try to.
I agree.
I agree. I mean, Jen's numbers with public health I think are the most direct we can get. Other ways to get those numbers, I mean, the confidentiality, we can't get it from doctors or therapists or things like that. It's all confidentiality. But Jen's numbers, I think, are the most solid we can use, and then it's going to be more. I agree with her.
Yeah, I mean, just looking at the children, it's hard to imagine after everything that everyone has gone through with COVID, that we are over 3 times the positivity rate that we were for the school year in the previous year. It's just unimaginable, but it is what it is. So I think getting back to the point, having actual data and numbers on specific issues and illnesses helps us, I think, determining if we can help you in any way with grant support or legislative support.
Yeah, the numbers are helpful when you can get them, and we all know they do shortchange the absolute. But the same thing in the school situation where Janet Reed was thinking of not continuing compiling the data, but I and Jen on board said that no, even though they may not be the absolute correct number, because we know what parents are doing, the moms are, not testing, not reporting, what have you. They're still helpful to tell us where it's going. And we are a New Canaan community, but when we look at our mirror image community of Darien and what's happened there in terms of suicides over the last couple of months, it's significant. And it's, we can mirror image that on ourselves. In terms of the suicide itself, Bethany, I don't know if Jackie and Marcy were on this with a Zoom with the Center for Hope and Families in Darien. But the 2 women they have there who deal with grief and suicide are very competent and caring, and they're so helpful in dealing with this issue as well as others. Stanford now has the Department of Health and the Department of Pediatrics at Stanford Hospital have aligned with a couple of other groups, just addressing the mental health issues of youth per se. So, it's out there, things are being done or in process, which is helpful moving forward with the sequelae from mental health sequelae from COVID and other pre-existing issues.
Yeah. This is Peter Campbell, Commissioner Harrison. I think those are some great points. And while I really encourage us to be in contact with Darien with their learnings and hopefully to provide aid and support to them, but I'm sure they're digging very deep in there. The one theme that I keep hearing in the younger folks is pressure. Certainly COVID has exacerbated that, but it's a longer term issue, the pressure on kids for achievement and the mantra of how hard it is to get into college and all of that. And I think New Canaan has been really smart and being way ahead of the curve with a lot of the resiliency programming from New Canaan Cares and the school system. But one thing I'll also say is that for those systems to really work, you need parental awareness as well. And probably everybody on the call here has applied pressure to our kids, because it is hard to get into schools and stuff like that. But to make the whole system work, I think a little bit of awareness for the parental side, what parents can do to reduce that kind of pressure might be meaningful.
Agreed. Although sometimes this pressure comes from the kids themselves. Jackie, that's an ongoing communication thought, right? We're addressing those issues, too much pressure, this, that, and the other thing in the school.
Yeah, absolutely. And I think, again, I hate to say it falls back on I've heard also the pressures kids are putting it on themselves. Peter and I actually spoke yesterday and I was mentioning that, even if their parents are not, but obviously it's just so long and embedded that, this is a community that, it's just a very, just academic, amazing community. And these kids, I really think the overdose issues and all of those, some of these people won't amass the wealth that their parents ever did. And they're just very fearful of, that, or they're put in a leadership position on a team. And then how can they carry that for the rest of their life? There's just so much pressure. The suicides in Darien, the kids were, I think a lot of them were sports oriented, had maybe scholarships on the horizon. There's been some throughout the country where they were sports. I think a lot of females I've heard recently, and in talking with Chelsea McGee at Family Centers, she was saying a lot of those weren't on people's radar, is what their parents are reporting. So this is information that, we need to get out. I do think the schools, try the best that they can. Obviously CARES supplements that wonderfully, but I think it's what people are willing to, some parents don't want any of this taught in the schools at all. So they want it off the table. And I worry about the kids that never get any of the education, because the parents are not doing that at home. So, these are always things that, come up, and I've been here going on 17 years. I feel like all of these topics have been discussed. I just think we preach to the choir. We get the same group of parents that, come through. A lot of you guys attend, this information, but I don't think it's getting out to the masses. That's why we've tried podcasts or articles or ways that people can get the information if they're not going to attend the presentation or so anyway, I hope that was helpful.
Yeah, one thing that Chelsea McGee and Julianne Green speak about, the other Center for Hope in Darien people that address the issue of suicide, was to keep this we often tend to not talk about it, introduce the idea to children, et cetera, but the discussion as they found out and approaching the topic and with children from parents, et cetera, is very helpful. So it's not something that should be not talked about. And so just another FYI.
Tom Ferguson, I just wanted to agree with Peter about the pressure. I think that's driving all the other problems with our kids. And we have kind of an impossible situation. If you look at New Canaan or Darien, a large chunk of the people who live here, particularly the younger generation of parents, are extremely successful because you can't afford a house otherwise. And just the law of mathematics and regression of the mean, the next generation of children is not going to be as good as the parents. And so we have a large group of kids in the school who aren't going to make it as well as their parents. And they're feeling the pressure and they're feeling discouraged. And so we have a system that's going to create a lot of problems with kids. And I don't know the solution, but I do agree that Peter's got the right read on it.
I have a thought, Harrison.
Yes.
One of the things, to go back to the other end of the demographic scheme of 65s and up, I saw some data from AARP in the last couple of weeks. looking at depression and anxiety, which is underlying all of the discussion that we're having. What shows up as mental health, clinical mental health in those studies is basically not indicative of or indicative of what is going on in anxiety and depression. Virtually any senior at this stage of the game, meaning anybody who's a parent or any adult, has depression and anxiety probably at 80–90%. The fact of the AARP study showed pre-COVID was anxiety was 12%, which is consistent with what the Silver Hill people said in our Mind and Body series 2 years ago. It's now 47% that would admit to being having anxiety and depression. And again, the article stated that's grossly understated. It's probably much higher. So anyway, the net of this whole thing is the whole mental health, behavioral health thing is a very gray area, and people move in and out of behavior patterns, anxiety and depression, which are the two biggest on a going basis. And it has to trickle down to kids, obviously. We hear a lot about that, but you don't hear much about the seniors and the normal adults. It's an issue, and it's how do you know when somebody's depressed enough that they're now suicidal? That's the problem. So I'm not sure we'll ever know that number.
Yeah, just to call out the active minds thing, I'm extremely interested in, because where a lot of this stuff winds up being detectable is if you're around real peers, and that's whatever peers, seniors,
Right.
top executives, or kids, because they're the only ones who really understand, and that's where openness comes up. And sometimes just by releasing and talking,
Right.
there's a huge mental health boost just from that, and realizing that you're not alone and that everybody's kind of going through this. And so, wow, I'd really like to double and triple down on this Active Minds program. I mean,
Yeah, it's great.
We've done a ton of that in my professional world with executives and
Yeah.
different groups like that, and it is incredibly powerfully liberating to be in a safe place, to
Exactly.
be talking, and the relief is palpable when you watch someone kind of open up like that. And I think with seniors, it's probably the same thing, because it's not easy to talk about, but once it comes up,
Right.
it really builds on itself, and real deep relationships can form, by the way, which is also the major antidote to a lot of what we're talking about is just deep trusting relationships, which I think is an antidote to a lot of the problems that we're talking about.
I agree. And that's why Marcy has started the groups at Lapham about life reimagined, or just aging in place. Staying Put, is another great organization that we work with, but it's having a safe place to express yourself. And the Active Minds, I know the chairman of the board, and his family had 2 of his 3 kids had mental health issues, and he went on, started this Active Minds, and it's gone, it's amazing. So I'm hoping, like you said, Peter, the peer-to-peer coming in at the space where they feel safe, creating that space. I think they might have a good model that the school could benefit, the town, parents, kids, and then having New Canaan Cares come in on it in terms of being the monitor, the adult supervision. It could be really good. So we're hoping, that it's a fruitful conversation on the 6th.
I'm just Barb Ackenbaum, Commissioner. I just want to reiterate what you were saying, Bethany, which is when Staying Put was during COVID, we had a lot of issues of people reaching out to people in depression, anxiety, mostly depression and isolation. But once we started having events again, we just had huge attendance. I think people were just so happy to be out, and every event was, bigger than they used to be. And so I think there definitely is a peer-to-peer support system that makes a difference.
Good.
Yeah, anxiety and depression are always statistically at the top. Just I'll give you the numbers from Child Guidance in Southern Connecticut. By the way, Dr. Jessica Welp is the is the director of that, and she is another phenomenal resource in terms of mental health problems, suicide, et cetera. So of all those, of the kids that presented, 50% are presenting with anxiety and depression, 14 with oppositional defiant behavior, anger control, 14% with suicide ideation. So that's a pretty significant number. And the others are down around the 7% with ADD, ADHD, and PTSD. So, and also reaction to divorce and unresolved grief. So anyway. Okay, so Bethany, I guess that's it, correct?
Can I ask a quick question? This is
Sure.
Jen Maddock, Commissioner. Does the commission ever play a role in just highlighting what's happening and supporting? So for instance, with the social and emotional learning initiatives in the schools, like those are hugely important. And we know that it's great that we have some groundwork laid so that we can continue to expand and work on those. And that directly leads to talking about teenagers and suicide. So is there a role for the commission to play in highlighting why that's so important? For the parents of younger kids who maybe don't think social and emotional learning stuff is that important, to help them make the connection about how that's laying the groundwork for as their kids get older?
Jackie, you want to answer that? I mean,
I was wondering if like maybe that's at the end of like the, because that kind of could be the end discussion about the commission. Hate to know what the new business is, but I wonder if like, because I definitely think you guys should have a role in the community and input. And Jen, you sit on the Board of Ed. That's great information. I mean,
I don't, but I do know
Okay.
from running for the Board of Ed that there is a whole slew of people that speak really negatively about these initiatives. And I think that they haven't quite made the connection of why this has started as a movement and why it's so important. And I feel like you guys are constantly putting out information. Here are resources. Here's what we're doing. Here's why. And I just wonder if the commission can also be doing that, or sometimes, unfortunately, I don't think it's political, but some people do. So are we not supposed to say we should all be supporting social and emotional learning in the schools? Or is that something we can do? I just want, when people say, what are we doing? Like, oh my gosh, we've had these suicides, and oh my gosh, kids are exhibiting all these mental health issues. Or I also think it's a huge opportunity where people who don't normally talk a lot about mental health issues in kids and youth are very aware of it right now because of COVID and all of the information that's out there. Is there a way that we can jump on it and sort of tie it all together and be supportive of, we are doing a lot of things in our community and we want to do more, and sort of outlining what that is for people? Just another attempt to communicate all of this information.
yeah, I mean, I think that might be something great, almost like an elevator speech of, funny, Peter and I just happened to speak yesterday and he asked, what can, I be doing personally, or, and honestly, I mean, I think it's having conversations with people that whatever groups that you're in, because I do hear, like an example would be, we had a LGBTQI, a presentation at LAPM back in, I think that was April now, amazing. It was like a doctor from Yale. But, there were 15 parents there, but they're feeling like, not comfortable around some of their kids, peers, parents, to talk about this stuff. But I think it's like using opportunities like that wherever you can to kind of talk about the importance of all of these topics, because obviously suicide is even higher among that, group of people. So, I think it's that. I really think it's that. I think just as many times, I know Dee Dee Bartlett is my co-chair for my New Canaan Abuse Prevention Partnership that she started, I think it's 19 years ago. I came on 17 years ago, but really what got that topic about healthy relationships off the ground in the community is taking time to go talk to the senior men's and NCL and all of these groups in town, so I think any opportunity that you get to talk to people like that, because you're right, some people think, we need to get back to the kids learning, but honestly, they need, I think, in every class to be learning about, you know, all of these topics, because this is where their life is right now. And social media, we haven't even talked about that. I really think that's what drove all this mental health issues to begin with, because we didn't have to worry about that. Alyssa, maybe you did, but I know some of your other ages, but we didn't have to worry about that. And can you imagine like how I mean, these kids feel left out and they are isolating too. And then on their own, they're not reaching out to like peers to say, that makes me feel. Marcy has a daughter, 10th grade, and she's telling me all the time how there's like check-ins. There was something recently you told me about that, like you get a ding if your friends are like somewhere. And I'm thinking, how awful would you feel if, you know, you being left out? We didn't know about the parties.
Yeah, there's like Snapchat maps and, you know, where
Yeah.
your friends are. And so if you see.
So we
everyone-
can't even imagine what they're going through and but I think Harrison had a point, keep these conversations going. Parents shouldn't ever feel like they need to know, let their kids know they're there. But Jennifer, you bring up a great point. I think it's just having these conversations and pushing back on some people that, you know, because I held a vaping talk. I think I want to say it was like 2019. And I had like 40 parents come to the library. And there are some that are like, oh, please, we don't want, you know, but then these parents were like, we'll stand in the bathroom and, you know, discourage kids. Obviously, kids probably won't go to the bathroom then if their parent is standing in the bathroom. But my point is, like, I think we're moving the needle. We have parents that care about this stuff. I love what they're doing in Wilton with like the free range parenting. And I think Lenore Skenazy is the person behind that. I think the school system is bringing her, but a lot of her points of view on, because when we talk about the pressure, how do we ease up on that pressure? Like, how are we, like, we need to start doing that in our homes with our kids. And she talks about it's hard because we're judgmental as a culture, you know, we're litigious, we're all knowing, you know, so these are things that, like, with this pressure, I don't know how we start to kind of dismantle some of this stuff and take it off, because this is, you know, in a community like New Canaan, and we have great surrounding communities, we're all kind of in this predicament. So anyway, sorry, I feel like I've spoken too long, but Jennifer, we can talk offline too, if you wanted.
I think Jennifer brings up a good point. I know it's probably under new business, but briefly, I think we have to set priorities. We can't do everything. And I think we talk about so many different things here, and everybody's doing such a great job and working very hard. But for me, if we set a baseline and we establish a couple of priorities, we measure them, and then we see how we can move the needle. I think that's what would be more effective from a commission. So to Jennifer's point, I think she's right on. I think let's pick a couple of these, let's go at it hard, and let's see if we can make an impact.
I have kind of a logistical question, Alicia Meyer, commission member. In terms of if we were trying to get the word out, letters to the editor or speaking at things, to the point Jen made that some people do see this as political, are we even permitted to be there to use our title of commission member? For instance, when I was on the West School PTC, we were not allowed to put in a letter to the editor, we couldn't put, Alicia Meyer, West School PTC board member. Are we allowed to speak in our sort of official capacity or no?
Well,
You do have to, you have to be careful about quorums though. If too many of you gather at somewhere, it becomes a public meeting that needs to be noticed and everything else. So before you do anything, I would get the ground rules from Kevin or the town attorney.
But according to our charter, we can make recommendations. This is Russ Park. So according to our charter, we can make recommendations to the administration. Absolutely.
So to the administration, but does that mean first selectman only? Does that mean the superintendent of schools? What constitutes administration?
I didn't write the charter, but I would imagine it means anyone in public office that we could be able to say, we believe are the priorities for the town of New Canaan, and we would like to see either money support or these initiatives.
I think Alicia's point is even broader. How can we use our individual voices in whatever forum or setting, and what are the limitations of that? I mean, should I put like Peter Campbell, commissioner? That's different than Peter Campbell. And people have gotten into tricky waters on that kind of thing. And I think maybe for the next meeting, if we could develop a working understanding of that, because I think that would be really important, because they're really interesting and talented people on the board. And what is the box that we are comfortable in terms of communicating and working on communications would be really good to know ahead of time, and then we can go forth and multiply after that. But maybe, Harrison, we can do a little work with the town clerk or whoever to really pin this one down, because I think it's a really interesting question.
I think we'll address a little bit of that further down. Jackie, the reason I pinpointed you was because, so we have the guidance counselors at the school, we have kids in crisis in the school, at least the high school. And I guess no further word with SACs, right, Bethany?
No, it's still,
okay.
there is a hiring issue. Yeah, finding the appropriate person.
And plus, Jackie, the information that you send out on a monthly basis about the talks, et cetera, a number of these issues are addressed. Now, whether parents or the community attends them is another story, but I think there is a sensitivity to it. There are presentations, an attempt to deal with all these issues. It's not like they're being negated.
Yeah.
So,
And there is a talk being put together through CARES, and we're bringing on Silver Hill to address the suicides in Darien for our communities, because a number of parents were like, how do I talk to my kids? Because I mean, what's scary that Dr. Bartolomeo says, sometimes when you're feeling suicidal, I mean, there aren't warning signs, or your energy maybe gets better, like your energy level, because to carry out an act like that, you need energy. So sometimes that's a sign that, kids will show. So, or any person will show, but so that is, hopefully it's going to happen next week. And I hope we get enough notice, but sometimes last minute works too. I know they were looking to do some kind of hybrid. I'm even toying with the idea of like, now the town is closing at 12:30 on a Friday, but maybe a Friday morning I can open up some hours for parents to just walk in and come talk to me about stuff. And maybe we just advertise, maybe I'll get some, and then we could have kind of small group discussions on, that's easy to do. So I can definitely offer that. I don't know if, they'll be busy now, but maybe in the summer, you never know, people do go away, but that's something I'm happy to do as well.
okay, thank you. We're running into a time issue again. Marcy, anything significant that you want to present?
No, I'm continuing to go to LAPM. I continue to hold the groups, Coffee with a Cop. We've had a bunch of referrals from EMS and Get About services. Bethany and I did go to our first visit at Millport. Laurel House is trying to come once a month to talk about the services that they're offering. And their first visit was last Monday. So we'll try to do another one next month.
Okay, thank you. That's Marcy Brand from Adult and Senior Services.
Sorry.
Okay. And Jackie, anything else you want to add?
Jackie DeLuey, I never said my name earlier. I'm the Youth and Family Services Coordinator. Sorry. That was one major thing about, talking about what we're going to do in our community to address sort of the suicides, because parents are, really nervous about this. Another presentation, Jen, if you were ever interested, Talk Saves Lives. So it's kind of a little bit shorter than a QPR, but it's all of identifying signs, who are risk groups. I do have a speaker that's willing to do that for support staff at the schools. So Susan Bliss is talking about offering that to them in August. So at least they'll have that information right before school starts, fresh in their minds. She also can do it for parents. And maybe she could really gear that message to parents. So that's something I'll let this presentation play out with CARES first, and then we'll see, maybe we could ask if there's an interest of running one of those. One thing with just numbers being up, I happened to look, recreationally, our numbers have drastically gone up with families wanting to go to the pool last year and this year. Like, it's like literally almost triple from like year back in 2017, 18. I have 20 families that have right now, but last year I think I had like over 30, and it used to be like 13 families. So I think more people have moved to town or need our services, but I also think, you know, these are great things. They want to get outdoors. I do think COVID might have provided, you know, people being maybe more active to do more things, you know, and not be so sedentary. So that may be one silver lining. You know, and then I continue therapist referrals, you know, substance abuse referrals. That's always happening. The divorce support group, I will say it's been tricky to get attendees. We'd like at least about 4 to really run the group. Last week, there were only 2. There is another one today. Hopefully we can get more. Worst case scenario, Family Centers is willing to, because we are paying for it, like through the Community Foundation, and Bethany had some money that we were able to offer a little bit, and then they're covering the rest. Family Centers would take it and they would hold it at the Center for Hope. Like, it wouldn't go away. But people would have to register, because I think this drop-in, no registration, people aren't really committed. The facilitator did reach out to some people I identified, which I think helps, because it's like you have a nice conversation and then you might feel comfortable to then attend that group. So I'm hoping those numbers, you know, go up, or maybe we try an evening, we'll see. And then just really tricky, like kids, and I do blame, I think this is COVID related, behavioral behavior issues with young preschool age kids, and not having right you know, places for them to go, because they kind of need sort of a more therapeutic sort of school setting, and West School does not have any space to take on. Yet these kids will probably be, you know, have some issues in kindergarten. So I'd love to see West sort of, you know, nip it in the bud, but they just don't have any space. So I'm looking outside the box, and even other communities to kind of help, you know, find spots for these kids that really need, and obviously the socialization. But I do wonder if, like, during COVID, yeah, we had to give them iPads and parents needed a break. And I just think these kids, they're hitting, they're, you know, it's a lot of stuff. They don't feel in their body. They have to move constantly. So we do see it abate, I think, as they get second, third grade. But, you know, it's hard to kind of place them in a preschool setting. That's very disruptive. So sorry, that's enough from me today.
Thank you, Jackie. Old business, there's nothing basically other than a recent update about you know, the goal with the Silver Hill program at New Canaan was to hopefully involve Richfield, Wilton, Darien. As of now, those things are not happening, and I think Darien was the last hope to be involved with that in terms of participation, in terms of supplying maybe numbers, patients, et cetera, but also financially with some of their ARPA funds. But I think Darien is working in another direction. They do not have kids in crisis in their schools, and I think they're trying to do that. Correct, Bethany?
Yeah, I mean,
Yeah.
it's sort of, maybe they'll come back around, but their decisions is not final yet, and they're looking at other avenues. Personally, I think you need both, and the ARPA funds are there, but it's what they choose, and we have to respect that.
Oh, yeah.
But
Now, even with kids in crisis, we need the backup in Silver Hill with the psychiatrists, et cetera. I mean, that's the ideal.
Yeah.
Bethany, Russ Barksdale, do we have an indication? Because my understanding is that once it was announced, Silver Hill, that they were inundated with calls. Do we have any indication of what those numbers are as of right now?
I didn't know. I did not receive any numbers from Silver Hill. In fact, July 1st is when it opens. They're going to try to, looking at July 1st for launching this New Canaan possibility. So I have not heard any of the phone calls.
Okay.
It is not going to be marketed in terms of come and call. Silver Hill is just concerned about accommodating. They don't want it to be a negative experience if all of a sudden they're not sure what to expect. in terms of the feedback and the opportunity that someone in New Canaan might take. So they want to start out very slowly. No marketing at this point, just to get a feel of the interest. And so as Andrew Gerber, who's the head of Silver Hill, as he says, it is baby steps, but they want the steps to be quality because they have no idea what the quantity is going to be.
Yeah, I realize we haven't marketed, but I do know that it did receive a lot of, press, good press, positive press.
Yeah.
And Jim, do you have any numbers on that, Jim Lisher? You're on mute, Jim.
I know that they got 25 calls, the first piece of press that came up, just based on the announcement of the program. I have no idea what they got after that. I know there's a consistent stream, but again, when I met with Andrew, Dr. Gerber, basically he was saying the same thing that was just mentioned, that they want to enter this program very slowly in order to do a good job and figure out what the real need is. So beyond that 25, I don't know, but I know that it's going to get a lot of play. Actually, one of the things as a result of that, I was invited up to talk about telehealth and telemental to the town of Newtown in a couple of weeks. And part of what they were seeing was the ARPA announcements of telemedicine, as well as the Silver Hill ARPA. And somebody picked that up out of the news and then said, well, maybe we should bring you back up to talk about what's going on in New Canaan. And this is with the first selectman and all the department heads. So anyway, it's a hot button. Not sure beyond the 25 what the numbers are.
Thank you, Jim. New business, I did send an email out. We had questions about what the commission can do in terms of committees, et cetera, individually. I did speak to Pam Flynn, who had all of the answers. She said all the meetings, large or small, committees or subcommittees, whether in person, video conference, or telephone, must be preceded by public notice, have an agenda, quorum, and minutes. So, that leaves us in a very formal posturing as to what we do outside of these commission meetings. So if we want to venture forth and do it, we have to have all those things aligned. So we'll see what the future brings in terms of that. Russ did send out his email about the agenda and changes, suggestions, et cetera. I did respond in email and answering some of them, at least from my perspective. Happy to open that up for a discussion. We are somewhat time limited again in terms of where we go forward with this, with the agenda, with what it entails, what the commission does, doesn't do. We discussed that a little bit earlier in the meeting, but all ears here.
I just have one small suggestion, and
Yes.
that is kind of in the area of, to the extent people land on, hey, here's something we should follow up on, I'd love to have those minuted. And so that, if we say we're going to do something or look into something, that it's minuted and someone will do it. And then there's a little part of the next meeting where that there's given a little bit of time, but even a little thing like Alicia's question, I'm happy to dig into that, or with anybody else, just these little steps on, we come up with something, is there a specific action that might be helpful and not very labor intensive? I think there's a lot of people who are willing to put in a little time between meetings to create a little bit of this forward movement. And it's a small thing, but it actually, I think, can make a big difference with commissions or organizations like this, because you wind up getting, you do that for 6 meetings, you get some nice net forward movement. And I know it sounds like a small tactical thing, but I think it's actually a very helpful concept and pretty easy to do.
No, I agree with that. And I think Alyssa puts everything in the minutes, right?
I was going to say, you want longer minutes?
No,
I'm just kidding. I understand what you're saying.
We're attuned to that. And yes, I think issues that remain unresolved, we should certainly deal with. And yes.
But can
Any-
it be like a separate section in the minutes? That's how we do it with other organizations and sort of action items. And then we report on the action items at the next meeting.
Definitely. I'll put that at the end.
Yeah, that's great. Sure.
One thing, Harrison, I'm having lunch with Bob Doran on Monday, and part of this agenda for that was to follow up exactly what we're talking about here, of ways that Channel 79, which Channel 79 depends on what the subject matter of the program is and how much merchandising and marketing it gets pre-airtime. But the fact is that the what's the name of the advertiser? Well, the advertiser and the New Canaanite is what I'm trying to come up with. Pick up what goes on to 79 also, so that, and then you never know who's reading from the Advocate and the other papers, and what translates into social media, whatnot. So anyway, the point of this whole thing is, if anybody's got any ideas as a result of this conversation we've just are completing as to ideas for Channel 79 programs, send it to me within the next 24 hours, and I'll put it on the agenda, and then I'll report in what we discuss. But Bob's the primary motivator behind the Let's Talk About It program in terms of producing the podcast and putting it on YouTube. And we're still running the Connected Mind and Body series that we produced in 2020.
First, Harrison, I want to thank you for your response to my email. Certainly, I know that all of us volunteer our time here. We want to make a difference in our community. We do so much. This team, Health and Human Services, do so much and have so many programs and services that we offer. But at some point in time, we got to look at the effectiveness of those programs, and it's hard to do that without having, data in front of you. I personally like data and like to, for the limited amount of time that we have each month, like to pick those 3 or 4 things, to Peter's point, and see if we can't move the needle on those 3 or 4 issues. We talk about an awful lot. There's an awful lot going on. I know all the ladies and the department are working extraordinarily hard. I take nothing away from them. I was hoping to get to a point of effectiveness if we have actual measurable results in what we're doing. And some of the data that we receive now, for me personally, living in the town, are alarming to me for the children. Depression, anxiety being up as high as it is, suicidal ideation being the numbers reported here, just over 90 days, and social media pressures. I mean, we should, as a commission together, be able to come up with 3 or 4 priorities. And that's my point. But I appreciate, again, I think we all joined the commission to make a difference. And it'd be nice if we spent our hour together with those actionable items as Peter suggested.
Thank you, Russ. I agree with you. We do want to have an effect other than just to stay here and discuss things. So we will attempt to do this as best we can and in our purview going forward. I mean, we are doing a lot. And as I mentioned, there are other organizations, school-related, physician groups, all sorts of medical providers doing their own thing, and we have a role too. So we can give it thought and what we're going to do, how we're going to go public with it or not, and move forward. I do thank you again for your attendance, and it is time. So may I have a motion to adjourn, please?
Motion to adjourn. Thank you, Chairman.
A second.
All those in favor?
Aye.
Thank you. Our next meeting will be July 7th. Would very much like to have in person, but with these numbers numbers being where they are, and hopefully June will plummet, and then we'll feel more comfortable and meet in person. We could also do something with hybrid, Alyssa, so.
I'm actually going to be driving across the country, so if it is only in person, then someone's going to have to take the 10 pages of minutes.
Oh, Alicia Meyer, you're back on.
Well,
I'm out of town July 7th, so.
Thankfully, the meeting's recorded.
It's all
so we'll
recorded.
continue the
Yeah, you don't
recording.
need to worry about it.
that's true. That's true.
I'll attend via Zoom.
Yeah, I can do Zoom.
All right.
Okay, anyway, thank you again. Enjoy the month.
Bye.
Stay safe, everyone.
Bye.
Thank you.